Hello to all the viewers. With me, I have got Dr. Himanshu Rana. Himanshu, it has just been over maybe an hour that the FMG results have been announced, and you have got an amazing score of 221 in an FMG exam that was not so easy. So, first of all, how are you feeling? Hearty congratulations, by the way.
Sir, it's the adrenaline rush. So I am feeling very happy and I'm very excited to know the result that I have scored 221, and
Yeah.
it's all God's grace and with the help of faculty, family and friends. It's an outstanding result for me.
Himanshu, be very honest. Let me tell you, if I ask you, were you expecting the score? Okay, yes or
Uh,
no?
Yes, sir, I was expecting this score.
Okay,
Actually, I was getting like 182, 220 also in the grand test. So it was yes, I
good,
was
good,
expecting.
good. I think it's a good score considering the exam toughness this time. I just want to tell the viewers as well. I was just talking to Himanshu and I understood that he is someone who likes to learn in depth as well about the subject, and he likes the clinical videos as well. This is very important because nowadays the FMG exam is turning very much clinical, and with the faculty lineup that we have in DocTutorials, with the clinical subjects being handled by practicing doctors, I think definitely it is going to be an advantage to all of you. So, Himanshu, let us go through your journey with DocTutorials. First, I'll start with the videos. Videos obviously will form the foundation stone of your preparation because that is the base. I just want to know how much of, how did the DocTutorials content in the videos help you form a strong foundation base?
So actually, the videos are oriented in a very grasping manner. It's like a web series. You attend one lecture, then it's a continuation to the other. So you learn through every step, and it's very feasible also. And the faculties we have, Dr. Raja Mahendran, Rahul Rajeev sir itself, and Dhawan sir, Sandeep sir, and our OBG faculty. I would like to specially mention that our OBG faculty is the best. I was also able to win a Olympiad in my university for the Ops and Gynae. So very, very, you know, helpful.
Yeah. And I think, OBG, I think deserves a special mention because she has done her OBG MS from AIMS Delhi as well. So even in her lectures, I know that she incorporates lot of scenarios as well. She shows you
Yes.
the actual patient videos as well,
Yes.
operative
All the
videos.
protocols are already in the videos, like how to manage.
Exactly. She's definitely an outstanding teacher. And so are other faculties, as you mentioned, Raja Mahindran sir, even in his lectures as well. Lot of his operative videos he includes in his lectures as well. And Himanshu, approximately what percentage of the videos have you covered from DocTutorials?
So actually, every clinic for the clinical subject, I did watch every videos 2 3 times because I had time in university because of the
Okay.
COVID COVID scenario and everything going on in Ukraine. So
Okay. Right. So you watched all the videos, in fact, multiple times as well. That is great.
yes, sir.
Yeah, good. And then let me ask you, uh, any particular subject that you're so fond of, maybe in future you feel that, okay, I should take this subject for post graduation as well?
So it's actually I do like every subject. The most I like is medicine only because I remember like one time it was like an online session with you only, you were teaching, and it was like one student asked you like what I must do to score very well in medicine. Then your answer was like you have to read whole Harrison, but you told that you have to trust me, I have read it and I'll make sure that you pass the marks with very good subject. So
Yeah.
it kind of created an interest in medicine, and I also like the way you teach. I did attend the NEET PG free videos also, which were done recently.
Okay, right. And see, as you said, the videos helped you build a strong foundation. and it is very important to have proper revision towards the end. So in
Yes, sir.
DocTutorials app, we have got revision videos, and we have done the MIQ series as well. So did you go through these videos, the revision videos as well as the MIQ series, and how beneficial were they?
So I think it's like a complete circle, you know. You do it one time and you revise it three times. First you do the clinical videos, you go to the quick revision practice, you attend the test and discussions, and then the MIQ series, which was like top notch content this time. So yes,
Okay,
I did attend everything and it was very helpful.
okay, right. And coming to MCQ practice, see, many students ask us, how important, sir, is MCQ practice. Many students keep reading, but they don't practice MCQ. As a top scorer, what was your strategy in a day? What percentage of time did you devote to theory, and what percentage for MCQ practice?
So, sir, yes, it's a very useful to start MCQ practice very early, and also do not hesitate to give grand tests. I think the key to scoring well is only grand test. If you start giving it early, it builds your reflexes. Actually, it's not the memory; it's the reflexes which are being built. So
Okay,
start early. Do the we have faculty curated Q bank, which is like the top notch quality Q bank of the country. So uh, do practice early, start early, and surely you're gonna do great.
okay. And for the viewers, for the various grant tests that we are doing at Doc Tutorials, we had done multiple grant tests with video discussions as well. Now, this is a definite advantage for the students, wherein when you go through the explanations, if you have doubt in any questions, you can just click on the video, where a very concise, crisp video, just over a minute or two, the faculty actually summarizes the whole content. So I think the future aspirants, please take note of that and give the grant test with the video explanations. Now, Himanshu, another point I want to ask you is regarding the grant test. How often did you give the grant test, especially towards the last few months of your preparation?
So I think in the last 2 months you should give it like once, once or twice. 15 days. I think every 2 week you must give once, so it
Okay,
will be good. Don't give it
right.
too often. Don't just keep on just giving it. Just give it in 2 weeks. You can give one.
Okay. And in the journey of a student, a foreign medical graduate student, I'm sure in this exam preparation journey, there were ups and downs. So, how did the faculty team actually keep you motivated? Because we have got Dhawan sir, Sandeep sir, who always, they motivate the students. They are always with the students, and we have seen them even near to the exam. Dhawan sir and Sandeep sir, they take extra effort to talk and interact with the students. So, how did that actually help you in having a proper mindset for the exam?
So it's actually a hand holding in terms of, I can say, with respect to the Rajiv Dhawan sir and Sandeep sir. So you can talk to them anytime. You can message them on WhatsApp. They are available every time. So it's the kind of effort that the faculties also put in, that the students are at ease to learn and they enjoy the journey also. So I think they are doing a very good job.
Okay, right. So, very happy to interact with you, Himanshu. And if you want to just give a few advices to your juniors who are currently, doing their, university abroad, can you give them some advice and also the importance of starting preparation early, considering the current pattern of exams?
So the best advice would be that whatever time you have, do invest some time in studies also. At least 2 3 hours you must put in a day, and start practicing MCQs also. If you start it early, then the when you will come here, then it will not be like very much hectic. You already should, and do attend the uh, all the lectures which are available. Do the clinical videos, because the pattern is changing, and now the exam was very clinical, so you must have an understanding of the clinical subjects. For the small subjects you can do it like close to the exam also, but for the clinical subjects like medicine, surgery, obs and gynae, it's very important to start it very early.
Okay. And how did you find the latest pattern? This exam, I have already said that, I felt personally that the exam was slightly on the tougher side, but as an aspirant, coming out of the exam hall, how did it feel, the exam?
So for me it was like an replica of the grand tests. I had given 3 4 grand tests, and I found it like it was a bit difficult, but it was like 70 80% similar to the grand test only. So that's the key, I mean, do attend grand tests.
Okay. So thanks a lot, Himanshu. Looking forward to hearing more of your success stories in the future. I hope that,
Sure, sir.
once you have your internship, you definitely go on to give the NEET PG exam, because I personally feel once you are done with the FMG exam, 70% preparation for NEET PG is over. And you complete the remaining 30 percentage as well and score a very, very good rank in NEET PG. And I hope that, I'll be taking your interview at that time as well.
Sure,
Okay.
sir, more to learn from you.
Thank you so much, Himanshu, and all the best.
Thank you, sir, thank you very much.